Okay, well, welcome everyone to another edition of TEPHI Talks, the Texas Epidemic Public Health Institute. These are routine sessions that we hold talking to various leaders in the field about how to make sure that businesses can stay operational when we have infectious disease outbreaks. We're housed with the University of Texas School of Public Health, and my colleague, Dr. Rios, will explain that a little bit here. But we have a very interesting talk today with regard to a group that's assembled before, during, and after.com that is focused on small businesses. So my name is Bob Emery. I'm the safety guy here at the Health Science Center. My faculty appointment is with the School of Public Health. And so let me kick it over to Dr. Janelle Rios for just a few introductory remarks, and then I'll introduce our speakers.
Hi, everybody. My name is Janelle Rios. I do have a faculty appointment at the University of Texas Health Science Center at Houston, also called UT Health. I'm at the School of Public Health, which is located in the city of Houston and across 5 other campuses in the state of Texas. So I'm also the Deputy Director for the Texas Epidemic Public Health Institute, or TEPHI, as we like to call it, because we love acronyms. So just a quick note to tell you guys who TEPHI is. We are committed to keeping Texans healthy, which will in turn keep the economy strong by strengthening the capacity and resiliency of Texas communities to respond to future infectious disease outbreaks. We are singularly focused on infectious diseases. And as I mentioned, we are housed here at the University of Texas Health Science Center at Houston. It's led by faculty members at the School of Public Health. So collaborations are key. We collaborate with other governmental agencies such as the Baylor College of Medicine. They help us with our wastewater discussions and the science that goes into that, into our early detection programs. And Texas A&M University, we partner with other governmental agencies such as CDC, of course, the Texas Department of State Health Services, Texas Department of Emergency Management. We partner with professional associations and other business entities and community organizations. And this is some of our community work photoed here on this slide. So please, I encourage everybody to connect with us. We have news and updates that we provide. We have a monthly newsletter that we send to folks. We have webinars like this one, and in-person and online trainings. Some of our courses are amazing. For example, we have a certificate in pandemic preparedness and response. That certificate includes 5 courses. You can take them online. And the last course, the first 4 courses are asynchronous, meaning that they're self-paced. The last course is online. It's a live tabletop exercise where you get to put together all the lessons that you've learned. We have a ton of resources on our website, and we just concluded our Texas Public Health Summit for the year, which is the highlight of TEPHI's year. So here's a handy QR code where you can connect with us. So that's a little bit about TEPHI. So a few housekeeping items about this particular webcast. You can access the live transcription or closed captioning by hitting the CC button at the bottom of your screen. To ask questions, and we do encourage you to ask questions, please use the Q&A button. Please don't use the chat button. That confuses us. We're monitoring the Q&A button, so please stick your questions in there. We are recording today's webcast. It'll be ready on our YouTube channel in about 2.5 weeks. So stay tuned for that. As soon as you exit the webcast, you're going to receive a survey. So please be frank on that survey. Tell us what you liked, what you didn't like. Offer suggestions for future webcasts as well. So again, use that Q&A button, please. And we are offering continuing education units for the certificate in public health only for this particular one. So to access those units, grab this QR code, and we'll show it at the end as well. One of my staff may have to remind me to bring that slide back up. But with that, I'm going to toss it back to Bob so you can introduce our esteemed speakers today.
Sure. Thank you so much, Janelle. So today we have an interesting conversation regarding a organization labeled beforeduringafter.com, which is an online resource with basic guides and advanced tools to help Texas small businesses prepare for, respond to, and recover from both natural and man-made disasters. This site provides access to authoritative information from a variety of sources in one place and is free to use. So our guests today include Dr. Rebecca Davio, who is the director of the Institute of Government Innovation at Texas State University, an associate professor of practice. She brings over 30 years of experience as an agent of change, implementing new approaches and service-oriented cultures in government. Also, we have Jackie Sekiguchi, who leads community affairs for the Texas Mutual Insurance Company. I understand she may be a little delayed, but she'll be able to join in for this discussion. She's focused on creating a strategic corporate citizenship vision that maximizes Texas Mutual's expertise to create an impact across the state of Texas. And then we have, last but not least, Justin McInnis, who's the president and elected CEO of TEXAR, and I'm going to have him describe what that is. He is a well-respected leader in the first responder and emergency management community across the state of Texas, and he was actually my first point of contact to get this all set up. So thank all of you for taking the time to join in, and I'll turn it over to you guys. So Dr. Davio, I suppose. Yeah.
Thank you, Bob. We are very excited to be here, and I would like to share my screen. We would like to tell you a little bit about Texas small business disaster readiness and the tool that we have developed to help enhance that resiliency. This is a project. Before I start getting into it, I'd like to share two statistics which led to its development. The first is that 99% of Texas businesses are small businesses. That was such an amazing statistic to me when we uncovered that small businesses are the lifeblood of the vibrant Texas economy. And the second statistic is that of those businesses that close after a disaster, FEMA tells us that 40% of those businesses will not reopen. 99% of businesses are small businesses, and 40% of them that close after a disaster are not going to reopen is not a good recipe for a healthy economy in our state. And so that's really what led our sponsors, TEXAR and Texas Mutual Insurance, to task us at Texas State University to help small businesses enhance their resiliency. When those small businesses are disaster prepared, they can act as force multipliers for their entire communities and improve resiliency for all of Texas. And over the course of this project, we have learned that small business specific readiness resources at once are sort of limited and scattered, and yet when they're available, when you can go find them, they're intimidating. And so the group of folks here, this public-private partnership, because we have been joined, the initial group of Texas Mutual, TEXAR, and Texas State, have been joined by the Federal Reserve Bank of Dallas, One Star, that recently the Texas Chamber of Commerce executives, and then we also have received some additional funding support from Wells Fargo. All of us have joined together to help small businesses become more resilient. And we have created beforeduringafter.com. And we wanted to have a really simple, easy to remember name for a couple of reasons. Gotta be able to get there and remember it to get there. And then we've tried to do with our brand, our site structure, everything is make it as easy as possible for small businesses to improve their resiliency and keep Texas economy strong. So this is just some of the screenshots. There's so much information within beforeduringafter.com. It's really a platform for disaster readiness communication. It provides access to authoritative information from groups like FEMA, Small Business Administration, the U.S. Chamber of Commerce, lots of those groups that have information to help small businesses that were scattered all over. We've collected that, and we want to help those small businesses prepare for, respond to, and recover from disasters. And one of the keys that we learned from small business owners we talked to is the importance of being involved with their communities before, so that those communities then are there for them after, and they can be there for the community, the other community organizations. So you can see here some of the tools that we've developed. We have a readiness roadmap for before. We have the information hub for during, the recovery timeline. We have, this is one of the community resources. So the very first thing on the readiness roadmap, it's like, if I ask for a show of hands, who has an emergency plan? Most of us probably wouldn't be able to raise our hands. And we realized it was just a little intimidating. Small business owners have a lot on their plate. And sometimes disaster preparedness does not come up. So this before section is organized, and we started with the easiest possible task. What can you do to help your business be more resilient? And that is signing up for alerts, and that will your local alert. And this actually is not an easy task for some folks, because those alerts go by different names. They're available at the city level, at the county level, sometimes at a regional level. And if you don't know where to look, you'll have a difficulty finding it. And so we believe we have the largest, most comprehensive list of alert signups in anywhere here in one place. And so that includes all 254 Texas counties, all the cities where they had them, the regional. And so that would be an overwhelming amount of information to dig through. And you'll see here that this is Hays County is selected because I'm in San Marcos, Texas, in Hays County. And so this automatically selected Hays County. You can use that to filter information that's very relevant to your locality and only what you're interested in. I should note that you could also use that if you have relatives in other parts of the state. You can select their county and find out how they're doing, what the reports are. So that helps. Right now, we have a lot of information about natural disasters. We want to include more information about man-made disasters and resources to help prepare for those. And because of this relationship with TEPHI, then we're also in the process of adding our local public health authorities in the state of Texas. This next resource, this is so the alerts was in the before section. This emergency information hub is in the during section. And this is something that is really critical to help you stay informed during a disaster. And this is especially useful for small business owners, but really any of us can use it because it's a ready source of information. It's got updates, weather, utilities, so you could see outage maps, for example, for all of the electrical providers that serve your county. We've got transportation information, aid locations, And again, it's all, you're not having to filter through the 12,000 plus web addresses and social media addresses that we've collected. It is filtered down to your local geography. And some other good things about using this information hub, you may say, oh, I'm signed up to with my local county's Facebook group, so I'll get that information. But the way that we are presenting the information doesn't require you to have a Facebook or an Instagram account or that kind of thing. And you also don't go through their filter. You're getting real-time information from this resource. This next example is from the after section. We wanted to have an insurance checklist. And we at Texas State are not the absolute experts in all things disasters. What we've done is we've gone out to the engaged experts in, for example, insurance, to have them help bless this list that we've put together. This is where you start step one when you're going to apply for insurance. It's very important, for example, to not go out and start fixing things before you have documented everything, because your insurance agent needs to know what the original site was before, what it looked like after the disaster hit. And it's very practical information from experts throughout the site. The site is mobile ready and can be accessed from any of your devices. And you may notice from this screen in particular, the site is presented in dark mode and without a lot of fancy pictures or color pictures. That's for two reasons. The dark mode is going to use less battery. If you are in a disaster and you need to save your battery life on your phone, for example, having the dark mode is going to do that. And also not having those fancy full color images that might be fun to look like in the before section, not having those slow down the information that you need during an actual emergency. So that's a very quick overview of before, during, after.com, the tool that we've all collectively come together to create and help improve Texas small business resiliency. We, just like Janelle invited you to join, we invite you to follow us on our social media there. So thank you very much.
I don't know if Justin or Jackie went away, and I've already made a list of questions for you. I don't even know how the the audience has chimed in, but maybe let's just pause here for a second. Jackie, do you have? Thank you for joining us, first of all, and then I don't know if you had any additional comments.
No additional comments. We're just very excited to get the website into the hands of as many people who are interested in using it and supporting it as possible.
Okay,
Absolutely.
great. Okay, thank you. And then Justin, I don't know. You probably need to explain to the folks what TEXAR is. So,
yeah.
So
how does TEXAR fit into the fold, right?
Yeah.
So Texas Search and Rescue, we're a disaster organization in the state of Texas. We're a VOED member, and our place is disaster recovery, helping during disasters, points of dispensing, doing the, reports on, damages assessments and things of that nature. And so where this all came to be and the relationship was TEXAR was looking for new partners and opportunities and donors to help move the needle in the disaster space, and had a great conversation with Jackie and the Texas Mutual team, who is also very vested in moving the needle and doing stuff, productive things for the disaster space and helping our economy and helping our people become more resilient and recover from disasters. And so we had a great conversation. How many conversations we had, Jackie? We had great amount of conversations, and we built a robust relationship between all teams and have created a great product. if I may say, that is a work of passion and a work of love, because we're all vested in it, right? Whether it's Texas Search and Rescue as a VOED who relies on small businesses as donors or in-kind donors, or is a small business in and of themselves by definition, right, as a nonprofit, or, you know, from Jackie's standpoint and, you know, insurance and business and, you know, as well as Dr. Davio and applied science and using, you know, information and data to make informed decisions to help people in their daily lives.
Okay, great. All right, well, thank all of you for joining in here. I have written down a series of questions here, but before I go into Bob's list, maybe Janelle or Rocio.
There is currently no questions online at this time.
Okay, all right, well, good. I'll take care of it then. Okay, all right, no, because so Jackie, I'm very curious about the notion, if you go back to this concept of before, during, and after, the notion of before, one of the things that would fall into that rubric would be having insurance, philosophically, right? Because there was a mention about after, how do I make a successful claim, but it's probably important to have the insurance on the front end. But with regard to the scope that TEPHI has, do you have any experience or any information regarding claims that small businesses might have had due to COVID? I'm curious about that.
Let's see. We did, you know, I think the pandemic was such a whirlwind for us, and just like everybody, but just really trying to navigate in real time you know, what was coming at us, getting access to PPE, you know, helping our 75,000 plus businesses prepare themselves, keep their employees safe. You know, all of that was a tremendous effort just to kind of ensure that we were doing things on the proactive side of things to keep people as safe and healthy as possible. And then on the claim side of things, that is, you know, again, something that we were really working on in real time, teams virtually coming together and really trying to look at claims holistically. From every perspective, and ensuring we were kind of doing right by the system and by our policyholders and by the by, you know, individuals who were had COVID. And so it was really kind of a holistic approach to, you know, navigating a really you know, unprecedented, I don't know if you can talk about COVID without saying that word,
Right.
you know, event. And so
well, let me tell you the reason I'm asking this question is that we interacted a lot with the Houston Safety. Janelle helped me with, I always mess up the name of it. It used to be called the Houston Area Safety Council, and now it's something else. But anyhow,
Health and Safety Council.
Health and Safety Council. Anyhow,
Pasadena.
and so we were tasked to interact with a variety of small businesses, because what they were grappling with was the operationalization of the recommendations that were coming from CDC and WHO. And sometimes those things were changing, right? The whole notion of masking, and you get the idea. And so going back to this concept of before, during, and after, on the before side, if a small business can afford it, it seems to me it's prudent to get insurance. But I guess what I'm really asking is what perils are covered under, I guess it's anything you choose to purchase, but is this considered to be a natural disaster? I don't know. I mean, that's our charge, having to do with infectious disease outbreaks. That's what I'm trying to understand.
Yeah, I would love to circle back with you for an answer on that question. My background and expertise is around community engagement. And so although I've been in the insurance field for, you know, going on 8 years, the, you know, specifics around insurance policy, I don't, I'm not the expert. So, but we have access to those experts, and we would love to get you that answer.
No, and that's great. I mean, that's what we want to have, is this dialogue, because I'm thinking of insurance where the typical things, you know, might be a hurricane or a fire or a flood, or, you know, then you get into the nuances of that. But infectious diseases are a little bit different. And it's just, to me, it would fit into your guys' rubric to be aware that, you know, here's what you need to do, protect yourself before, during, and after this sort of event. Because another one's coming. It's clear, you know, the data is clear that there's going to be another one that comes. It's just, how do we make sure folks are protected there? So.
Yeah, and Bob, can I jump in a little bit to that too?
Sure.
One of our partners is the Federal Reserve Bank of Dallas, and they're
Mhm.
doing a lot of research with small businesses around kind of coverage and asking, you know, them what they need in order to be prepared. And one of the things that we found in that research is that after Hurricane Harvey, most people did have insurance, but they didn't have the right kind of insurance. And so I think that's very consistent with what you're talking about, is that you really have to get in the details and in the weeds with your insurance agent, really specific about the things that you feel your business might be at risk of, right? So if you're in Lubbock, maybe you're not thinking about hurricanes, but you might be thinking about fire, right? Could be thinking about infectious disease. And so really, I think with before, during, after, and in that pre-section, like there is resources that connect to like the insurance, independent insurance agents of Texas, right? Because it really goes back to the website itself not being the expert, but the website itself being the connection to the experts.
Right. And I see, to me, I'm just putting on my risk management hat here for a second, but the different types of perils, because at the end of the day, when you're buying insurance, it's typically fire and all other perils, right? That's the traditional stuff. But the question then for a small business could be, does it cover these other eventualities? It's just something to ask, you know, that's all. And I think that's something that TEPHI could help with, because maybe I don't know this to be the case, but maybe in many cases it's not covered. Okay, well, that's good to know. So, you know, so that we can plan accordingly as we're doing this. So that was the reason for my questioning there.
Yeah.
Okay, I'm stopping here because I've got a slew of other questions, but Janelle or Roro, are there other ones there?
Yes, I actually do have a question.
Yeah, okay.
And the question was posed as, how can the Texas legislation support small business resiliency, especially against public health threats, this upcoming session?
I don't, y'all are the public health experts. Do you want to take a stab at that?
Yeah, you know, that's your job. I think you have to answer that.
So let me take a stab at that. Thank you,
Okay.
Rocio, and thank you for the viewer who posed the question. So we at TEPHI are very excited about what we do. We're very committed to public health in the lane of infectious diseases. You know, communicating with your elected representatives and supporting the work that TEPHI does and public health departments do, that would be very helpful. So, but it starts with the regular person out there. So if that's something you'd like to do, we welcome it. So I hope that answers the question. Thanks.
Okay, so this one's for Dr. Davio. One of the things I found fascinating over the last 2 or 3, or however long it's been, 2 or 3 years, is of the different small businesses that we've interacted with, the restaurant industry in particular became very adaptable. And I did not realize this, but Rocio Rodriguez, who's behind the scenes, we were asked to go down and give a presentation at the Texas Restaurant Association convention, which is in Houston. I didn't realize this is the second largest such organization in the country. And the notion of changing from the you know, drive-through versus coming in, spacing, that kind of stuff. I was wondering if you had some comments, because it seems to me that sort of information would be helpful going forward in these activities.
Thank you for that question, Bob. We actually, there is a section in the before, during, after,
Mhm.
about, as you're going through and thinking, how can you pivot
Mhm.
and make, sort of, to use an old cliche, lemonade out of lemons. That it's like, what can you do? But that's where the planning really comes into play. There's lots of studies, I think you mentioned, that show that planning and doing some preparation up front is much more cost effective than trying to recover after.
Mhm.
And so just thinking through, what are these crazy things that could happen? We might not have envisioned a pandemic, but what might happen? How could we potentially become more resilient?
Mhm.
So I think we do have a little bit of information about that, how small businesses could prepare. And I think the Texas Restaurant Association is a very shining example of doing that, of going from in-house to being able to do takeout. That's still something that's changed our lives. And also the ability to get alcohol to go just is something that, that was also a very big pivot for the way we lived our lives in Texas
Mhm.
that was creative on their part.
Yeah, I was amazed at their adaptability. Anything from, not having communal salt and pepper shakers to individual, that all of that stuff that we all remember, right? And so it's been kind of an interesting transition. Okay, this is a joint question for Rebecca and Justin. And it has to do with wastewater monitoring. And Janelle can weigh in here a little bit, but we are partnered with Baylor University, or Baylor College of Medicine. And it's become interesting that when sampling wastewater, it gives you perhaps, and Janelle, keep me honest here, perhaps a 5-day advanced notice of when an outbreak is occurring in a certain, what you and I would call a watershed, but the exact term they use is a sewer shed, believe it or not. So anyhow, so this then begets the issue of, okay, we see that, whatever the disease of the day is, it looks like it might be coming from this area. We can forewarn businesses, going back to the concept of before or perhaps during, but then also from Justin's perspective, what might one do that's if once armed with this information, I guess is, that's a difficult question, but they're going to need some help and probably some door-to-door education in this area about how to protect themselves and what to monitor for, I think. And maybe, well, anyhow, I'll stop yapping there, but so.
Yeah, I guess I'll tap into put my old emergency management head on real quick. I think we listen to the experts, right? We are funneling information before, during, after, is taking information from the subject matter experts like yourselves, right? Who are in the epidemiological side of the house, and public health and whatnot, and help really amplify those messages and saying, hey, these are things that we need to be aware of, right? Businesses, once, like, I know you guys have already had a conversation with Justin Oaks and whatnot. Once information starts coming overseas or coming stateside or whatever, and we're starting to listen to those things on the wire and whatnot, we start enacting our plans, right? As emergency managers, as the response community, like myself, right? We start enacting our plans, we start analyzing, we start listening harder. Of course, the conference calls start, the meetings start, and then we start to disseminate all of that information. And I think from a business perspective, who is trying to be prepared for a disaster, right? Y'all are doing the monitoring, y'all have the partnerships, y'all are sharing that information that we can then share to the small businesses to say, hey, this is probably something you should be aware of based on lessons learned from the last pandemic. And here's what you need to start implementing to make sure you're more resilient in your community and be able to respond to the community's needs, instead of, right, being caught flat-footed and on your back heels, right, and taking the blows instead of being a part of the solution, because you were prepared.
Well, it's interesting. One of the things we've tried to do through TEPHI is to provide some basic information to businesses about what might be concerning and what isn't. And again, Janelle can weigh in here, but the notion, take two different infectious diseases, COVID as compared to Mpox. Okay, so if business owners just know the basics between the two, the way they're transmitted, hey, Mpox isn't going to be a big problem for me. I can continue in my things that I do. Whereas COVID, we got to do the spacing and the masking and all that kind of stuff. So we've actually made some basic orientation things that Janelle maybe can weigh in here, but I think we've made 2 or 3 kind of basic guides for things that businesses should know when they hear about something rattling up. And that may be of interest to you guys as well. But if you hear something rattling up in the news or whatever, World Health Organization, is this a concern to me in my business versus other ones that might be highly transmissible? So
Yeah.
I don't know, Janelle, are you? Yeah. So do we have that on the TEPHI website or yeah?
Oh, gosh, probably. Yes, probably.
Okay.
We also published a paper 2 years ago, maybe 3 years ago, where we talk about some basic information. And tell you what, before this recording is released, I'll go ahead and add that to the emails
Right.
that everybody who registered for today's event will receive.
But that seems like a nice addition to their website under the heading of infectious disease. That
Yes.
it would be essentially a basic directory on what is this. I run a barber shop. Is this going to be my problem? What do I got to do about it? Versus some other one that you might have to space out or something like that. So.
Well, I think it's important to also clear up kind of the noise that's out there, right? The media that's going on, right? I know there people are talking about viruses coming from glaciers that are starting to melt, right? That's not of concern, but you've got monkeypox or something that's starting to grow, bird flu, things of that nature, chronic wasting disease. Those are things that are way more impactful. So helping clear up the clutter, and again, going to your point of clearing messaging is key, but not over messaging as well.
Right. And so I'm sorry, go ahead, Rebecca. I'm sorry.
I just wanted to say, I think that's sort of where a tool like before, during, after could help, because y'all have put out a lot of very important, helpful information that's broad educational information. And before, during, after, if the local public health authority puts out information that says we have had an outbreak of infectious disease within our community, now it's not everybody all across the state that needs to be worried. It's very targeted, and that information that comes from the local experts to their local community is so important. And it really underlies the need for good local communication by the emergency manager, the public health authority, the local sheriff, whoever that designated communicator is. So before, during, after provides a tool to help with that communication and help facilitate.
Well, I'm curious because in this day and age, half the problem we have in responding to these sorts of issues is misinformation. And I'm curious that, I don't know if you have folks that are perhaps monitoring for misinformation. Take what we can step outside from infectious disease talk, disaster of the day, whatever it might be. But monitoring, and I won't say counteracting, but perhaps clarifying misinformation that might be out there. Is that part of the role of this entity, the before, during, after, or?
Well, I think we're an information relayer for information during
Okay.
a disaster. That
Mhm.
that would be incumbent upon the local emergency manager to say, this is the actual situation here in our community.
Mhm.
Ignore that. And what the role that before, during, after can play is to get that to everybody that's aware of the site, to get it, even if they don't have a Facebook account or Instagram or other social media. This site serves up that information, and they're going to get it in a very timely fashion without going through all the social media filters.
Mhm.
And so that's how we can help with that clarifying information.
Right. I think back to Justin's point of sorting through the noise, right? Because there's those poor folks in Western North Carolina right now from the flooding area. There's all sorts of noise. I was in North Carolina before I came to Texas. That's the reason I bring it up. But there's a lot of confusion around that response.
Right.
Mhm.
Another thing before, during, after does is it filters out all that sort of chatter and
Mhm.
comments.
Mhm.
That, you're only getting information from authoritative sources. You're
Mhm.
not hearing from somebody who I heard that there was,
Right. Because it's an emotionally charged time. I certainly,
Absolutely.
acknowledge that. But I mean, it's just powerful to be able to say, where can I go to get legitimate information, not opinions, to address things there. Okay. Let me pause there. Rocio, are any other questions coming in, or?
Yeah, I actually would like to ask Jackie a question. I understand that Texas Mutual has provided the lion's share of funding to enable developing of before, during, after. Why would a workers' comp insurance company provide support for this?
Yeah, thank you, Rocio. I don't know that I explained, Texas Mutual well enough earlier, but so Texas Mutual is a workers' compensation insurance company. We only do workers' compensation only in Texas, and we have about 75,000 policyholders across the state. And after Hurricane Harvey, we contributed about $10 million to local policyholders who had gotten who had been damaged, their property or had some kind of disruption, because we realized how much devastation there was. But then that's really the first time that we felt that really kind of direct impact to our own business, and thought about kind of with the how frequently these disasters are happening, looking at the stats like the ones that Rebecca shared earlier, and how much of this was a business risk for us. And so even though we don't insure property, we still felt like this was directly of direct importance to kind of our business. If 40% of our businesses in the Houston area are at risk of closing every time there's a significant weather event, that's a problem. And so we really came at it from both the community angle of how we wanted to support philanthropically, but then also really from a business risk perspective. And so after about $20 million of kind of emergency response philanthropy distributed over the last 7 or 8 years, we really thought that there is more we could do about helping small businesses be proactive and prepared when these things happen. And so when Justin reached out and connected us all about before, during, after, we felt like it was a really natural alignment of we believe from a philanthropic perspective that what's good for us, what's good for the community, what's good for the economy is good for us. And so this project in particular really felt like that was the perfect balance of ensuring small businesses were protected, knowing how important small businesses are for communities and families and the economy, and then seeing how that directly impacts our ability to run a business. All of that being in place, it was a really easy way of saying this is something that we should go all in on.
It's fascinating. The statistics that you shared at the kickoff here were amazing to me. That the number of proportion of the economy that's based in small businesses is really fascinating. And it got my wheels turning about collecting data on, because inevitably we're going to have another disaster here, you know, whatever it's going to be, a freeze or a tornado or a hurricane or whatever. But that notion of the recovery of the businesses, I have no idea how many businesses just went out of business due to COVID. I don't know that number, but I suspect it was pretty significant. Even when you were trying to be adaptable, there's only so much you can do until the money runs out, I would think. So, and then so on the after side, I guess it's probably a question for Rebecca. On the after side, it may be that a business has some insurance, but there's also federal assistance or state assistance, like the Small Business Association, stuff like that. Is that addressed in the site?
Yes.
Where those other means of recovery might be available? Yeah.
Absolutely. That's actually sort of how this started out. Justin and Jackie came to us and said, you know, let's go find all the government agencies, whether they're local, state, federal, that help small businesses after disaster. And, you know, we started looking, and it's really amazing and, quite honestly, overwhelming to try and find, oh, you have a small farm? Well, the USDA has special programs to help sheep farmers, or, you know, different kinds of initiatives, and to really, so there are links to federal websites in particular that provide information and post-disaster assistance programs, so that, you know, the small business owners aren't having to, with everything else that they're having to deal with, going back and trying to find what's the resource that's right for my company to help. And again, we provide some information about how to get the information together. It's also covered in before, because you have to have your vital business documents available. They can't just be available on your desktop computer if something happens. You know, so we help you with information on how to prepare before, but also how to apply for assistance and reimbursement from your insurance company.
I'm curious. I don't know how long this has been in operation. Several years, or so?
3+ years. And
so I'm just curious what thrills and spills you've been through, and are there any success stories on the? Yeah, because I would imagine you've been through something.
oh yeah, well, there's a couple of them. It's sort of, we knew that we wanted to help. We all knew that we wanted to help small business disaster resiliency, but we started out looking for these government organizations, and we thought, oh, we'll just print a little brochure. And then we started getting more and more and more resources. And so that's how we ended up with a website, so that information could be served up and it could be filtered by the geography. But we really, probably one of the biggest bits of excitement for us here at Texas State University as we were collecting the information was we started out with Twitter handles. That was how a lot of government agencies communicated information. And we'd gotten through, I think, all the 254 counties and had our list of Twitter handles for the sheriff, for the you know, emergency management office, all these multiple different for every county. And then Twitter was bought, rules were changed, and we had to go back and recollect information for every county and the cities about how they were now putting out information. So that was my particular bit of excitement. I'll let Justin and Jackie add anything that they found particularly exciting.
Yeah, so I'll add, we started, so this conversation's lasted for what, 4 years, Jackie and Rebecca, trying to get to this point where we launched at our event this past summer, earlier this summer. And so when we were testing it and using it behind the scenes during the wildfires up in the Panhandle, we were able to go through all of the data where, again, authoritative sources were trying to get the message out that, don't bring things that we don't need, right? Make sure that we need proper hay, and this is where the hay needs to be dropped off. These are the supplies that we want. And this is from Texas AgriLife, right? And so we were able to monitor those requests and then make those actionable items, and saying the authoritative resources are saying, I need X supplies, and we were able to get them X supplies, right? Quality hay, not just ditch hay that, only a goat could eat, but you can't feed to a horse, those sorts of things that were very, again, I learned a lot about hay that whole entire time. I actually have a hay broker now, which I didn't know existed. But we also were using and looking through all of those data points from social media as to what locations were still under evacuation orders and what locations were allowing people back in, and then monitoring that behind the scenes and helping build out Excel sheets for partners that needed information on who was allowed back in and who was not. So it's a great resource for so many reasons, right? From a volunteer perspective, what volunteers are needed and where do they need to rally, what donations are needed for that community and where can they be dropped off at a point of dispensing or a collection point, as well as making sure that the community had the right information and, the response side of the house, they knew, what areas were clear, what areas were not, at that 50,000 foot limit. So it was a great success story.
I'm curious, Justin, were you guys, given your role that you're describing, were you guys involved with administering it? What, were either doing COVID testing or administering vaccines, or was that outside of your purview?
Yes, sir. Texar was in the vaccine side of the house as well as testing. We weren't providing the vaccines, but we were there helping with the logistics and helping draws, but never, plunging. Although we do have a medical director that oversees all of our medical personnel, but we were helping out with the points of dispensing and logistics.
So, yeah, okay, the pod. You guys were involved with the pods, the points of distribution. Okay. Yep.
Testing and making sure that all the people going through getting their tests, and then once the vaccination started becoming available, then getting them through the whole entire process as well.
Interesting. Okay, great. Okay, we are getting to the tail end here. First of all, thank you all for participating. I don't know if there's any residual questions. Rocio, I'll ask.
I do have a question for Justin. What role can local emergency management and public health officials play in improving small business disaster resiliency?
Communication, getting into their community, listening to what their community needs. It's a two-way street, right? I'll talk about how, again, putting that old hat back on, when we were running the county, we talked to HEB, right? And said, what is it that you need to be back up and running? Because we realized that, people want to get back to some sort of semblance of normality, right? Although it is a disaster scape, there's a lot going on. There's a lot of stress. People want to buy the food that they want and drink the beer that they want to drink, or whatever libation they choose, right? And so just those simple likes, those simple things in life help the recovery of your community move a lot quicker, get them back into a better mental state. And so that was our relationship with HEB as a business, right? It's a very large business, but still in the community, they were kind of the hub, the foundation in certain circumstances, right? And so, the conversation was, we'll get you back up and running as quickly as possible, get the roads cleared so people can come to you for food, for water, for whatever it is that they need, as well as talking to some of the other small businesses that were out there saying, this is how you need to prepare. And, again, listening to their plight, especially, here in Central Texas, where we deal with a lot of flash flooding, and listening to the community members and listening to the small businesses who said, we just don't know how to communicate with those people who are coming into our community for Airbnbs and whatnot, who don't even know what a flash flood is. So then it became more communication and more education and public outreach opportunities for the community as a whole, so they can come to different events and public speaking engagements with National Weather Service and whatnot. So it's important that emergency managers provide opportunities for education for the community and allow them to ask questions and bring subject matter experts into their communities to talk with them and share their information.
Justin, with all your comments, I'm stunned you didn't mention toilet paper. That was like the big thing.
Sears catalogs and corn cobs.
Well, no, one of our previous TEPHI talks, we had a business, the office supply representative, and the entire talk was on supplying toilet paper. It was actually pretty interesting when you think about it. So, Rebecca, looked like you had a comment.
I was just going to add real quick that I think it's also very important for those local emergency managers to communicate regularly. They're in the emergency operations center and getting all this information, and they know, and they have a million responsibilities, but someone needs to be designated to communicate to the community members and keep them informed. It's even, I was actually in sort of a wildfire scare right by my house, and it's like I got the first alert, but I never got much afterwards to tell me it's okay, it's under control, or still stay put, whatever. So that emergency communication real time is very, very important. One other thought, if I could, real quick, I do want to say that the website's free, completely free to use, brought to you courtesy of Texas Mutual and our other sponsors and supporters. And so we encourage your listeners to use it, to give us feedback. There's a feedback button on it.
Okay, great. Okay, well, thank you so much. I think Janelle may have a few closing remarks, but there's probably some tidying up here. So
Yes. I do want to remind everybody that in order to get your CPH continuing education units, to take a photo of this QR code. And if you are interested in TEPHI, participating in TEPHI, I'm going to move forward. So hopefully everybody got this photo snapped. Oops, actually, there we go. So here's another one to our general website, and we can always connect you. If you didn't get your question asked and answered, we can connect you with these fine folks on this webcast at a later date. So please communicate with us as much as you like, because we are here to serve you. So thank you very much for attending, and thank you very much to the speakers. Bob, back to you.
Thanks, Janelle. And thank all of you for participating and taking your time to share the information you have. And Rebecca, when you're in town, let me know. We'll validate your parking.
And lunch, right?
There you go. That's right. So, okay. All right. Thanks everyone. And we've got another event coming up, I think, in 2 or 3 months, and you'll get emails about it. Okay. Thank you.
Thank you for hosting us. Goodbye.
Yes, thank you.